Can a blepharoplasty be performed to correct asymmetrical eyelids? Info about me. I am Asian and 18 to 21 years of age. Both parents have the double eyelid fold. My left eye does not feel natural and eyelashes curl inwards.
Thank you for your question. You've submitted a question and you identify yourself as being between the ages of 18 to 21 and that you have asymmetric eyes, mentioning that your parents have double eyelids and that your eyelashes are turning inward in the left eye. So although you've submitted, only one photo, I'll tell you a little bit about what you do in my practice. I have a lot of experience with Asian eyelid surgery. I'm an oculofacial cosmetic surgeon, and I also have a lot of experience with Ptosis surgery. And I'll explain why I'm mentioning this. When we look at a patient who's concerned about asymmetry, there are two critical aspects that you have to determine before deciding whether blepharoplasty, the question you submitted, is the right thing for you. First is determining the eyelid height. Now, when someone has a lot of skin overhanging the eyelid, well, it can make the width of the eyelid, or I should say the height, between the margin of the lower eyelid or the iris at the bottom part of the iris to the margin of the upper eyelid. Now that height is called the interpalpebral fissure. And what we want to determine by measuring that height is whether or not there's a condition called ptosis. Now ptosis means drooping. And when we talk about eyelid ptosis, that's how we refer to it. When we talk about other parts of the body, such as in breast surgery, we talk about breast ptosis. So if you have eyelid ptosis, then it's a slightly different operation than a blepharoplasty. When you have eyelid ptosis, then we have to evaluate the levator muscle. And this levator muscle is like the word elevator, except without the letter E. Now that means that we would have to do something to advance the muscle or shorten the muscle to get the height to be equal. So that's part of a more extensive evaluation. And when we do this evaluation, we look at the eyes both in primary gaze or looking forward and looking down and looking up to determine the muscle function. Now the other part of the equation is, of course, the skin fold. Now you mentioned that your eyelashes are turning inward. Well, this is actually a relatively frequent condition in people of Asian descent. Very often in the lower eyelid, the condition is called epiblepharon. And what it means is that there's a fold of skin that pushes the eyelashes, and in certain situations, when those eyelashes are actually touching the eye, a correction has to be done to prevent irritation and potential scarring of the eye itself. So, in your situation, you might be best served with a limited blepharoplasty to address the fold of skin that is causing your eyelid to turn, or eyelashes I should say, to turn inward. Essentially, although you've submitted a question about the asymmetry and you have a relatively decent photo, the photo does limit how much of an opinion you can get without a proper examination. So I recommend that you meet with a qualified, experienced cosmetic surgeon. Typically, if there's an issue with ptosis, you would be going to an oculofacial plastic surgeon and get an evaluation that involves all of the things I mentioned, the proper evaluation for ptosis as well as the evaluation of the fold of skin over the eye. And once you have you're comfortable with the doctor you meet with, then you can make a decision about proceeding with your surgery. Be also aware that when people are concerned about asymmetry, asymmetry is not just limited to the soft tissue of the eyelids, such as skin and the levator muscle, but sometimes asymmetry is also related to the natural underlying bone structure. The human face is not perfectly symmetric, and if you look at your face long enough, you can actually notice the subtle asymmetries between the two sides. But specifically with your issue, which sounds like there's a real difference in the skin fold of your eyelid, I think meeting with a qualified and experienced cosmetic surgeon will be in your interest. So I hope that gave you some guidance. I hope that was helpful, and thank you for your question.